When it comes to blood tests, fasting plays one of the most crucial roles in ensuring that the results reflect a person's true health status. Many seniors are asked to fast for anywhere between 8 to 12 hours before certain tests, especially those related to glucose, cholesterol, triglycerides, and liver function. The reason for this is very simple. The body reacts to food intake in a predictable way, and consuming meals or even snacks before the test can drastically alter the results, sometimes leading to unnecessary concerns, additional testing, or even incorrect treatments. For seniors, who often go through regular blood work to monitor chronic conditions like diabetes, high cholesterol, or heart disease, this becomes even more important because accurate readings form the foundation of their treatment plans. Unfortunately, one of the most common mistakes seniors make is either forgetting about fasting or underestimating its importance. Some may assume that a small piece of fruit, a biscuit, or even milk in their tea or coffee won't make a difference, but in reality, even the smallest intake can cause changes in blood sugar levels, lipid measurements, or other metabolic markers that the doctor is trying to evaluate. For example, triglyceride levels can rise dramatically after a meal, sometimes up to double or triple, giving the false impression of severe metabolic imbalance. Likewise, blood glucose levels can become artificially elevated, leading to a potential misdiagnosis of diabetes or poor blood sugar control, when in fact the problem is just that the fasting window wasn't followed properly. Fasting doesn't just mean avoiding solid food, it also extends to many beverages. This is where many seniors get confused. Water is the only universally safe drink during fasting, because it keeps the body hydrated without altering blood chemistry. However, many seniors mistakenly consume tea, coffee, fruit juice, or even chew gum before their test, assuming that liquids are, just a sip, won't harm the results. But drinks containing caffeine, sugar, or dairy can spike blood sugar or influence liver enzymes and hormone responses. Even sugar-free or diet sodas can create small metabolic changes that throw off the results. A classic mistake is adding milk or sugar to morning tea or coffee before heading to the lab, and later being surprised when the doctor finds their glucose or cholesterol numbers higher than expected. This becomes particularly problematic when doctors adjust medication based on such inaccurate numbers, leading to unnecessary increases in dosage or new prescriptions that could have been avoided. The timing of the fast is equally important. Most doctors advise scheduling fasting blood tests in the morning, so that the fasting window overlaps with sleep. This makes it easier to avoid food intake and minimizes the chances of error. But seniors often have irregular routines. Some might wake up late, snack at night, or even eat out of habit before remembering they have a test scheduled. Missing the correct fasting window by just a couple of hours can throw off results significantly. Seniors with diabetes are especially vulnerable because they sometimes fear low blood sugar during long fasting hours. This fear may push them to eat something right before the test for safety, not realizing that doing so can completely distort the outcome. In such cases, they should always consult their doctor about safe strategies for fasting without risking hypoglycemia, rather than deciding on their own to break the fast early. Another overlooked issue is the effect of medications taken during the fasting period. While most prescribed medications should not be skipped unless a doctor advises otherwise, there are certain supplements or vitamins that should not be taken before a fasting blood test. For example, biotin, a common vitamin supplement, can interfere with thyroid and hormone tests. Seniors who take multivitamins in the morning with juice or milk may unknowingly be affecting multiple results at once. To avoid such complications, It's always better to take medications with plain water if fasting is required and to inform the lab about any morning medicines taken. A clear record helps doctors interpret results correctly. For seniors, fasting also brings physical and mental challenges that should not be ignored. Prolonged fasting can sometimes lead to weakness, dizziness, or irritability, particularly if they are already dealing with chronic illness. This discomfort sometimes pushes them to cut corners by eating lightly before the test. However, such shortcuts can end up prolonging the process instead of simplifying it, because the doctor might order a retest when something looks abnormal. In fact, unnecessary repeat testing is one of the biggest consequences of breaking fasting rules. Retesting means more stress, another lab visit, another needle prick, and sometimes even additional costs, all of which could have been prevented with proper preparation. It is also important to understand that fasting does not require seniors to overcompensate afterward. Many people rush to eat heavy, greasy food immediately after the test, thinking they deserve a reward for their patience. But this sudden intake of fried or sugary foods can cause fatigue, stomach upset, or even dizziness due to rapid changes in blood sugar. A better approach is to plan a balanced breakfast or light meal after the test that restores energy gently. This ensures not only accurate test results but also a smoother overall experience. Doctors recommend seniors set reminders for fasting tests, write down instructions given by the lab, or ask family members for support to avoid mistakes. Sometimes the issue is not lack of discipline but simple forgetfulness. Many seniors take multiple medications daily, and their morning routine is tied closely to food or drink. A small slip, like taking medication with orange juice instead of water, can undo hours of careful fasting. Family involvement or digital reminders on phones can be incredibly helpful in these situations, ensuring seniors walk into the lab fully prepared and confident that their results will truly reflect their health. At its core, the purpose of fasting before a blood test is to create a level playing field in the body's chemistry so doctors can accurately measure baseline values. Any deviation from fasting not only risks inaccurate results but also disrupts treatment plans. For seniors, who often already live with delicate health balances, this can create unnecessary stress and confusion. Therefore, fasting should not be seen as a burden but as a critical step in making sure the time, effort, and discomfort of getting a blood test are not wasted. The more carefully fasting is followed, the more reliable the results will be, and the more confidently doctors can make the right decisions for ongoing care. Medications, supplements, and lifestyle factors are among the most overlooked yet powerful influencers of blood test results, particularly for seniors who often juggle multiple prescriptions and daily health routines. While food intake before a test is widely discussed, the subtle ways in which medicines and supplements can skew results are less commonly explained, leading many seniors to assume that everything they take daily will not interfere with testing. In reality, certain drugs, vitamins, and even natural herbal remedies can produce significant changes in blood chemistry, sometimes mimicking disease or masking a problem that needs medical attention. This is why understanding the interaction between blood tests and daily intake is so critical for accurate diagnosis and treatment. One of the clearest examples is how cholesterol and lipid tests are influenced by medications. Seniors often take statins or other cholesterol-lowering drugs, and while doctors generally expect them to continue their prescribed regimen, the timing of when the medicine is taken can still influence results. Taking the dose right before the test might artificially suppress cholesterol levels, making it seem as though the medication is working more effectively than it actually is. On the other hand, Skipping a dose before the test, thinking it might show the real picture, can create abnormal spikes in cholesterol values, giving doctors a distorted view of long-term control. The same logic applies to medications for blood sugar, blood pressure, and thyroid function. For example, insulin or oral diabetes medications directly affect blood glucose levels, so if they are taken in the wrong window before a fasting test, the blood sugar reading may not represent the true baseline. Supplements also add a complicated layer. Many seniors take vitamins daily for energy, bone health, or immunity, often unaware that these can interact with blood test readings. Biotin, a common vitamin found in multivitamins and hair or nail growth supplements, is a classic example. Even small doses can interfere with thyroid tests, hormone assessments, and certain heart markers. This can lead to false results, sometimes suggesting thyroid disease or cardiac stress when there is none. Iron supplements, too, can alter ferritin and hemoglobin readings, making it seem like iron levels are either much higher or much lower than they actually are. Vitamin D, calcium, and magnesium supplements can affect kidney and liver panels, sometimes masking deficiencies or creating an illusion of excess. Because many seniors take these supplements daily, they might not think twice about consuming them before a test, but this small act can cause unnecessary confusion in lab results. Beyond traditional medications and supplements, herbal remedies and over-the-counter treatments also deserve attention. Herbal teas, powders, and capsules often contain compounds that can influence blood clotting, liver enzymes, or kidney function. For instance, ginseng can affect blood sugar, while garlic and ginkgo have blood-thinning properties that might influence clotting tests. Street John's wort, often taken for mood support, interferes with liver metabolism and can skew liver enzyme readings. Even common painkillers like ibuprofen or aspirin, often taken daily by seniors, can impact kidney and liver test results, as well as clotting factors. Seniors who fail to disclose these habits to their doctors or labs might end up with test results that raise red flags unnecessarily. Lifestyle factors like alcohol consumption and smoking also play a subtle but significant role in shaping blood test results. Alcohol, even in moderate amounts, can elevate liver enzyme levels temporarily, giving the impression of liver inflammation or damage. A glass of wine the night before a test may not seem like much, but it can easily distort results, leading to follow-up investigations or unnecessary worry. Smoking, too, alters blood pressure, red blood cell count, and carbon monoxide levels in the blood, which can be mistaken for respiratory or cardiovascular issues. Seniors who smoke a cigarette before a blood test may find their hemoglobin levels altered, making it harder for doctors to assess their true health condition. Sleep and stress levels, often underestimated, are also critical lifestyle factors that can skew results. Poor sleep can raise cortisol, the stress hormone, which in turn affects glucose metabolism, immune response, and even cholesterol levels. A senior who spends a restless night before a test might unknowingly arrive with elevated blood sugar or unusual hormone markers that do not reflect their normal state. Similarly, stress before a blood draw, such as anxiety about needles, can cause adrenaline spikes that temporarily alter glucose and blood pressure. This is why doctors sometimes recommend being calm and well-rested before major blood panels, as lifestyle stress can mimic or exaggerate health problems. The biggest challenge is that seniors often do not connect these factors with their blood results. Many assume that only food intake matters, so they might follow the fasting rule but continue with vitamins, supplements, pain relievers, or evening alcohol, unaware of the consequences. This misunderstanding can lead to unnecessary changes in medication, retesting, or even misdiagnosis. For example, a doctor might see high liver enzymes and assume there is a problem with fatty liver or hepatitis, when in reality it was just the effect of alcohol the night before. Similarly, abnormal thyroid results influenced by biotin might lead to unnecessary thyroid medications, which can cause long-term side effects. The solution lies in communication and preparation. Seniors should always ask their doctors or lab technicians which medications and supplements to pause before a test and which ones to continue. Doctors typically advise not to stop critical prescriptions like blood pressure or heart medications without guidance, but they may recommend skipping certain vitamins or non-essential supplements for at least 24 hours before the test. Writing down a list of all medications, including herbal remedies, and sharing it with the healthcare provider helps ensure results are interpreted in the right context. It's better to provide too much information than too little, especially since many interactions are not obvious to patients. In addition, seniors should develop a mindful approach to lifestyle habits before a test. Avoiding alcohol and smoking at least 24 hours in advance, getting proper rest, staying hydrated, and not engaging in extreme exercise are small but important steps. These actions do not only ensure more accurate results but also reduce the stress of having to repeat tests due to unexplained anomalies. Planning ahead is key. Marking the date of the test, adjusting routines slightly, and asking for help from family members can all make the process smoother. Ultimately, medications, supplements, and lifestyle choices shape the internal environment of the body, and blood tests are simply a snapshot of that environment at a specific moment in time. If the snapshot is influenced by external factors like pills, vitamins, or stress, it may not represent the true picture of health. For seniors who rely heavily on these tests to guide long-term treatment decisions, accuracy is non-negotiable. By taking the extra step of understanding how daily habits influence results, they protect themselves from misinterpretations and unnecessary medical interventions. The goal is not just to follow instructions blindly but to recognize how even small daily choices can ripple into major medical consequences. Being proactive and transparent about these factors ensures that when seniors sit across from their doctors to discuss results, they are truly talking about their real health, not an artificial version influenced by avoidable mistakes. Hydration, caffeine, alcohol, and smoking are some of the most underestimated factors when it comes to preparing for a blood test, and for seniors, they play an even bigger role because of the way the body changes with age. Many seniors believe that as long as they follow the fasting rule, everything else is under control, but in truth, even the way one drinks water, consumes coffee or tea, has a glass of wine, or smokes before a test can dramatically change the results. These substances directly affect blood chemistry, circulation, hydration levels, and organ function, which means that even if food is avoided, the test may still not reflect an accurate picture of health. Seniors who undergo regular blood work for conditions like diabetes, cholesterol, kidney disease, or heart health are especially at risk of misinterpretation if they do not pay attention to these lifestyle factors. Water intake is the first and most important piece of this puzzle. Staying hydrated before a blood test is essential because dehydration thickens the blood, making it harder to draw and sometimes even leading to inaccurate readings of kidney function, electrolytes, and red blood cell counts. Seniors are more prone to dehydration because of natural aging, reduced thirst sensation, or medications like diuretics, which flush water out of the body. Walking into a blood test dehydrated can lead to lab values suggesting kidney stress, high sodium, or other abnormalities that might not actually exist. In addition, dehydration makes veins less visible and more difficult to puncture, often leading to painful multiple needle attempts. Drinking sufficient water in the hours before the test not only improves accuracy but also makes the process smoother and less stressful. The rule of thumb is to drink plain water and avoid all other beverages unless instructed otherwise. Caffeine, commonly consumed through tea, coffee, or energy drinks, is another factor that can interfere with test results. Many seniors have the habit of starting their morning with a cup of tea or coffee, even before a fasting test, assuming that it does not count as food. The problem is that caffeine stimulates the nervous system, raises heart rate, increases stress hormones like cortisol and adrenaline, and temporarily alters blood sugar levels. A cup of black coffee may seem harmless, but it can spike glucose readings or give the impression of hormonal imbalance. Coffee with milk or sugar is even worse, as it directly breaks the fasting state and significantly alters cholesterol and glucose tests. Even herbal teas, depending on their ingredients, may affect liver function or hydration balance. Seniors who cannot skip their morning caffeine should plan their test early in the day so they can return to their routine after the blood draw, rather than risk altering results by consuming it beforehand. Alcohol is another hidden disruptor of blood test accuracy. Drinking alcohol the night before or even 2 days before a test can elevate liver enzyme levels, making it appear as though there is inflammation or liver damage. Alcohol also alters blood sugar, triglycerides, and hydration status, all of which are commonly tested markers in seniors. For instance, a single glass of wine can cause triglyceride levels to rise temporarily, giving the impression of uncontrolled cholesterol. Similarly, beer or liquor can affect kidney function markers and lead to readings that suggest dehydration or stress. Seniors who consume alcohol regularly may not realize how long it lingers in the system, as the liver takes hours to process it, and in older adults, this process is slower. Doctors often recommend avoiding alcohol for at least 24 to 48 hours before a blood test, but many seniors forget this detail, leading to results that don't reflect their everyday health. Smoking is another habit that can distort test outcomes, especially in older adults. Nicotine and carbon monoxide from cigarettes have immediate effects on blood chemistry, oxygen levels, and vascular function. Smoking before a blood test can raise blood pressure, increase red blood cell count, and alter hemoglobin readings, sometimes suggesting underlying respiratory or cardiovascular issues that may not actually be present. It can also temporarily raise blood sugar, giving a false impression of poor glucose control. For seniors who smoke regularly, these effects can complicate the interpretation of results because doctors might attribute abnormal numbers to disease progression instead of recognizing them as temporary effects of smoking. Ideally, smoking should be avoided for at least several hours before a blood draw, and informing the doctor about smoking habits helps provide context to unusual lab values. The interaction between these factors can also compound problems. For example, a senior who smokes in the morning, drinks coffee, and forgets to hydrate may end up with blood results showing elevated blood pressure, high blood sugar, and abnormal kidney function all at once. A doctor unfamiliar with the patient's habits might interpret this as multiple medical issues, potentially ordering unnecessary tests or medications. In contrast, when lifestyle habits are managed properly before a test, the results show a much clearer picture of underlying health conditions without being clouded by temporary influences. Another aspect that seniors often overlook is how these factors affect the body's baseline state. Blood tests are designed to measure the body under normal, controlled conditions, but caffeine, alcohol, and nicotine push the body into a heightened state of stimulation or stress. Cortisol levels rise after caffeine, liver enzymes fluctuate after alcohol, and red blood cells shift after smoking, which are not the baseline values doctors need to make medical decisions. These substances essentially create a false reality in the bloodstream. For seniors who already deal with delicate health balances, this false reality can be misleading and harmful if doctors change medications or treatment strategies based on it. A practical approach is to treat the day before and the morning of a blood test with as much care as the test itself. Drinking enough water throughout the day, avoiding alcohol entirely, skipping morning coffee or tea, and refraining from smoking for at least several hours ensures that the body is in its most natural and stable state. Seniors who are heavily dependent on caffeine or smoking might struggle with these changes, but planning tests early in the morning reduces the waiting time and makes it easier to avoid breaking the rules. For those with memory issues, family members can play an important role in reminding and guiding them through the preparation process. The takeaway is that hydration, caffeine, alcohol, and smoking are not minor details but central factors in shaping accurate blood test results. Water supports accurate readings and makes the blood draw easier. Caffeine alters glucose and hormone levels, alcohol disturbs liver and kidney function, and smoking distorts cardiovascular and respiratory markers. Each factor alone can skew results, but together they can create a cascade of misleading numbers that complicate diagnosis and treatment. For seniors, who often rely on these tests to monitor chronic conditions and guide important health decisions, the stakes are too high to ignore these influences. By making small but deliberate choices, drinking water, avoiding stimulants and toxins, and approaching the test with discipline, they can ensure that their results reflect their true health and not a temporary, artificial state. Stress, sleep, and physical activity are often treated as secondary details when preparing for a blood test, but in reality, they can be as influential as fasting or medication use, especially for seniors whose bodies are more sensitive to changes in daily routine. The body is not a static machine. It reacts constantly to the environment, mood, rest, and physical exertion. Blood tests are designed to capture a clear baseline picture of how organs, hormones, and systems are functioning under typical conditions, but if stress is high, sleep is poor, or unusual physical exertion occurs right before the test, the results can give an artificial snapshot. For seniors who already undergo frequent monitoring for diabetes, cholesterol, thyroid, or heart disease, this distorted snapshot can complicate diagnosis and lead to unnecessary worry or intervention. Stress is one of the most powerful yet invisible disruptors. When a person is anxious, the body releases stress hormones like cortisol and adrenaline, which prepare the body for a fight or flight response. These hormones temporarily raise blood sugar, blood pressure, and heart rate while also influencing immune markers. For a senior walking into a lab nervous about needles, results may show elevated glucose or cortisol that have nothing to do with their actual long-term health. This false elevation could lead doctors to believe that diabetes is worsening or that adrenal glands are overactive. Seniors who are managing chronic illnesses may already feel anxious about their health, and this mental state directly influences the numbers that labs pick up. Even the stress of getting to the clinic on time, waiting in a crowded room, or worrying about test outcomes can affect results, making stress management a critical but often overlooked part of preparation. Sleep, or the lack of it, is equally significant. A single night of poor sleep can alter the body's internal chemistry enough to mimic disease states. In seniors, poor sleep is common due to age-related changes, medications, or conditions like sleep apnea or insomnia. Lack of deep rest raises cortisol levels, disrupts blood sugar regulation, and affects cholesterol metabolism. A senior who spends the night tossing and turning before a blood test might show higher fasting glucose, unusual lipid levels, or hormonal imbalances. Doctors relying on these results could misinterpret them as signs of worsening diabetes or cardiovascular risk, when in fact the problem is temporary sleep deprivation. Over time, if repeated tests are done in a sleep-deprived state, patterns may appear that do not reflect reality, prompting unnecessary treatments or lifestyle restrictions. Physical activity, though generally beneficial for health, can also skew blood test results if performed intensely right before a test. Exercise causes muscles to release enzymes like creatine kinase and lactate dehydrogenase, which in high levels can suggest muscle injury or stress. For a senior who does heavy gardening, climbs stairs repeatedly, or decides to get some exercise the day before a test, blood results might indicate elevated enzyme levels, leading a doctor to suspect muscle inflammation or heart strain. Exercise also temporarily alters blood sugar, lipid metabolism, and hormone balance. After a vigorous workout, glucose may drop or spike depending on timing, and triglycerides may appear abnormal. While regular exercise is encouraged for seniors, unusual exertion right before a test creates misleading values that do not reflect their usual state. The interplay of stress, sleep, and physical activity can magnify the issue. For example, a senior who has poor sleep, wakes up anxious about the blood test, and hurries to the clinic after climbing several flights of stairs may walk into the lab with elevated cortisol, high blood sugar, unusual heart enzyme readings, and blood pressure spikes, all in one test. This combination could lead a doctor to believe there is uncontrolled diabetes, hypertension, and cardiovascular strain, when in reality it is just the cumulative effect of stress, sleep loss, and exertion. Seniors with multiple chronic conditions are especially vulnerable to these distortions because their bodies are less resilient to fluctuations, and small temporary changes can look alarming in lab results. Preparing for a blood test, therefore, should involve more than fasting or avoiding certain drinks. Seniors should make an effort to sleep well the night before, aiming for at least 7 to 8 hours of restful sleep. Creating a calm bedtime routine, avoiding late caffeine or heavy meals, and practicing relaxation techniques can improve sleep quality. On the morning of the test, arriving early, breathing deeply, and staying calm helps reduce stress-related hormone spikes. If anxiety about needles is overwhelming, bringing a companion or practicing mindfulness can ease the mind and stabilize the body's response. For physical activity, the goal is moderation. Light walking or stretching is fine, but intense exercise, heavy lifting, or strenuous chores should be avoided the day before and the morning of the test. This ensures that the blood reflects the body's natural baseline rather than a post-exercise state. Another layer to consider is how chronic stress and long-term sleep patterns affect recurring test results. Seniors who live with constant worry, whether about health, finances, or family, may consistently show elevated cortisol, blood pressure, or sugar levels in their tests. Likewise, seniors with chronic insomnia may have persistent disruptions in cholesterol and hormone balance. Doctors may interpret these patterns as disease progression, when in fact they are lifestyle-related disturbances. Recognizing the impact of emotional and behavioral health on lab results is crucial for seniors and their caregivers. It highlights the importance of holistic care, treating not just the numbers on a lab report but also the daily factors shaping them. Seniors also benefit from clear communication with healthcare providers. If sleep was poor, if unusual stress occurred, or if physical exertion happened before the test, sharing these details allows doctors to interpret results with context. A slightly elevated glucose reading may be dismissed as stress-related rather than treated as diabetes progression. Elevated muscle enzymes might be attributed to heavy lifting rather than suspected heart issues. Without this context, doctors may overreact, leading to unnecessary prescriptions, repeat testing, or hospital visits. Being open about lifestyle factors ensures the results are not taken at face value without understanding what influenced them. Practical strategies can make preparation smoother. Seniors should schedule tests in the morning to minimize fasting stress and avoid the fatigue of waiting through the day. Planning a calm, quiet evening before the test helps ensure better sleep and less anxiety. Hydrating well, arranging transportation in advance, and avoiding physical chores in the hours leading up to the appointment can all help create the right conditions for accurate testing. If stress is unavoidable, practicing deep breathing or guided relaxation in the waiting room can still reduce cortisol levels and stabilize blood pressure before the draw. Ultimately, stress, sleep, and physical activity are not minor details but core influences on how blood test results appear. They can exaggerate or mask conditions, leading doctors to see problems that do not exist or miss issues that need attention. For seniors, who often rely heavily on these tests to adjust medications and monitor chronic disease, accuracy is critical. Managing these lifestyle factors with as much care as fasting or medication preparation ensures that blood test results represent the true state of health, not a temporary distortion created by worry, sleeplessness, or exertion. By treating the night before and the hours leading up to a test as a time of preparation, seniors can safeguard not only the accuracy of their results but also the quality of the medical care they receive.